So my name is Mary Jackson, and I am a physician assistant, amongst other things. I graduated from Mount St. Mary's, so this is my alma mater, and I think that it really well prepared me for my career in healthcare. So I came in as a biology major and a chemistry minor. When I came to the Mount, I knew I wanted to do something in healthcare, but I wasn't sure exactly what. And I had some excellent opportunities to do undergraduate research, and I was paired with individuals to help me connect with shadowing opportunities. And so personally, I shadowed a physician, I shadowed a physician assistant, and I shadowed a nurse practitioner. And I ended up falling in love with my current profession, which is physician assistant. So we're going to talk a little bit about this option for anybody who might be interested in healthcare. And then we'll talk about the exciting opportunity that the Mount is building a physician assistant program. And I'm honored to serve as the inaugural program director for that program, which will be launching in 2026. So this is a picture of me in my ambulance bay. I work in emergency medicine. I've been doing that for about 15 years now. I still work clinically, even though academics is my full-time job now. That is a picture of my actual emergency department. When I was in PA school, I was actually terrified to rotate in emergency medicine because I had just come out of surgery. And so everyone I was suturing on and sewing up, they were asleep, and that felt very comfortable. And so when I walked into the emergency department, I thought I have to do procedures on patients who are awake and watching me, but fell in love on day one and still love it to this day. It's a lot of fun. Everything exciting happens in the emergency department. So I'll start by sharing a little bit about my profession. So I think nowadays it's pretty common to know a physician assistant and know what they are and know what they do. But I can tell you that 17 years ago when I went to school, that was not always the case. And I know that when I was early in my career, sometimes patients would say, I don't understand, what's a physician assistant? So I think it's really important to educate. And so this is from the American Academy of Physician Assistants. So that's our national organization. And basically, PAs are licensed clinicians who work in every specialty and every setting in medicine. And we do a lot of things. So and I might even have it on the next slide. I do. So we see patients, we order tests and studies, we perform procedures, we diagnose patients, we prescribe medicine, we counsel patients and develop care plans. We assist in surgery, we do clinical research. And so we really do so much. I know in my emergency department, PAs work top of scope. So I'm doing all of the spinal taps, which are called lumbar punctures. We intubate patients. I manage critical patients. I also manage non-critical patients. And so there's really just so much that you can do with a degree as a physician assistant. And we've seen in the past couple of years that the amount of PAs that are now in administration, like helping to run hospitals and hospital groups, has doubled in just a couple of years. So there's just so much that PAs are doing. What I love about our profession is that we really help expand access to care. Healthcare equity is huge for me, and so I'm really proud of my profession in that way. This is a schematic that was put out by the AAPA last year, and it just shows some highlights of the profession. So PA is the #2 job in healthcare, and it is the #5 job in the United States of any profession, any type, right? Not just healthcare, not just science. PA has been in the top 5 for like the past 10 years. So there's something going on here, right? It's not just me who's jazzed about this career. PAs tend to have better work-life balance. They tend to enjoy their profession, and patients tend to really enjoy the connections that they make with their PAs, which is amazing. I'm going to transition a little bit from talking about what a PA is and does to talking about this very exciting endeavor that the Mount is doing right now, which is we are building a School of Health Professions and developing a physician assistant program. So this picture that you see on the right is the architect's rendering of what our School of Health Professions will look like when it opens this coming fall. These are my teammates. So we're growing our team. What I love about this team is not only is everyone dedicated to our mission, which we'll talk about in a minute, but everybody comes from a different background in medicine, which I think brings so much to the table and so much of what we can offer our students, right? I bring the emergency medicine background. My APD, Leanne, did work in emergency medicine for 2 years, but she has been working in outpatient primary care. Megan has done clinical research at NIH. And also works in primary care. She's also done surgery. Kevin does occupational medicine. Laura Rose does behavioral medicine. And Tara does chronic illness. And Dee Dee, our medical director, is a pediatrician. So we really run the scope of all different medical specialties, which I think makes our team very dynamic. So the Mount has a mission in which it talks about helping students to live lives of significance. And when we were building the School of Health Professions, we really wanted to build off of this mission by the idea that graduates, our healthcare graduates, would learn how to care significantly. And so we have 4 pillars that really bring us back every time we come to a crossroads and we're making a decision about the program or the school. We always come back here to our pillars, which are equity, well-being, service, and compassion. And we'll talk a little bit more about this a little bit later. So when the School of Health Professions launches in the fall, and this is the architect's rendering here on the right side of the welcoming atrium when you walk in, so it'll be 2 stories high. We will not only have the physician assistant program, which launches in January of 2026, but we'll also house the already launched and already very successful applied behavior analysis program. And those ABA therapists will be operating a fully functional pediatric behavioral health center right here in Emmitsburg, which will not only be an excellent opportunity for them to train more ABA therapists, but this brings highly needed resources for pediatric patients and their families here to rural Emmitsburg, where the need is great. So 2 things that we're building in addition to these academic programs and the health center, we're building 2 non-academic programs that speak to our mission, support our mission, but also bringing in, we're interweaving into the curriculum itself. So the Mount took the time before they built the School of Health Professions to ask themselves, what are the challenges facing healthcare today? And the 2 that we felt were the most critical were healthcare inequity and healthcare worker burnout, right? So my little spiel on healthcare equity is that right now in 2024, you can have 2 patients with the same everything, same health history, same condition, but one of them can have a negative outcome, sometimes even as significant as early death, compared to the other counterpart only based on social determinants of health. And that should shock you. It's outrageous and it's unacceptable. And so what we're doing here is Care for America is doing several things. One, we have a scholarship program. So we have a certain number of full tuition scholarships to bring students through the PA program in exchange for a commitment to work in a high needs area following graduation. So that alone is transformational. But also we're bringing Care for America into the classroom in a 3-part course series called Healthcare Equity, where we teach students who are future clinicians, where are we in 2024 in terms of healthcare equity? What's the important history of how we got here? And what do we do to impact change from here, both on the small scale and on a larger scale? So that's Care for America. And you can see here's the picture, one of the pictures of the Pediatric Health Center. That's one way that we're bringing resources into a high needs area. The next supplemental program is called the Center for Clinician Wellbeing. So I'm sure everybody has heard of healthcare worker burnout, right? The pandemic really made that famous. The unfortunate truth is that this existed and was a crisis before the pandemic set in. And so you can imagine the levels of crisis that we're facing now. And so at the center, we're doing something that is very unique and that almost no other programs, if any, are doing in the nation right now. And that's taking the training and putting it in the pre-professional phase. Before you ever experience any symptoms of burnout, we want to enhance and provide for our students skills and training that are shown to have a positive impact on well-being so that students can be prepared from the first day they ever step foot into the clinical arena. So we are very excited about this work. And here, the picture on the right shows the Center for Clinician Wellbeing, which will be a physical space in the building where students can actually go to do these skills practices. So the physician assistant program is launching in January of 2026. It will be a 24-month program, so a traditional length program, where the first year is primarily didactic in the classroom, and the second year is primarily off on clinical rotations, where you're applying what you've learned in the classroom. We do have a course at the end where we bring everybody back for the last 4 or 5 weeks to really capstone all of the different courses and make sure everybody's ready to go into clinical practice. Like most PA programs, this is incredibly rigorous. Our program is 119 credits in 2 years to graduate with a Master of Medical Science. The picture you're looking at is standing on the second floor of that atrium, and that second floor is where the PA program is housed. This is my favorite slide to talk about. So the picture is the architect's rendering of our main lecture hall for the PA program, which I think is lovely. I went to a PA program that was also lovely, but was in a windowless room. And you pretty much spend about 8 hours a day, 5 days a week, every week of the first year in this classroom. So it's really important that you enjoy your space that you're in. But this slide looks at what makes us distinct. How are we different from other PA programs? So first and foremost, we're in a rural area where there's low access to healthcare. And so we are giving preferential consideration to local candidates in an effort to bolster the workforce locally. The second, which sounds like it should be common, but it actually isn't, is that most of our faculty are currently working clinicians. So myself, I'm still working in emergency medicine. I also still work on an ER telehealth platform. I think it's so important. I always use the pandemic as an example. How can I prepare a student to go out and be a frontline worker in the pandemic if I myself am not putting myself at risk and knowing exactly what that's like? And so almost all of our team work clinically so they can bring that relevance into the education. The next is we're really focused on helping support the transition from an excellent student to someone who's a safe and effective provider. So when I'm in the emergency department, I always have a student that I'm precepting from PA school. And I find that the students are excellent, they're motivated for the most part, and they have a lot of medical knowledge ready to take those multiple choice tests. But it's a completely different skill to be able to apply that in a complex patient environment. And so we're looking at things like teaching bedside ultrasound and constantly facing complex cases to get students ready to be able to manage these patients. And then we've already talked about how we're bringing in burnout and care for healthcare equity into the classroom through our different course series. We don't have to go in depth here. These next 3 slides actually seem a little overwhelming. A lot of people do ask, like, what courses do you take in PA school? The good news is that most PA programs have similar courses. We have one accrediting body in the entire nation, and they say you have to offer all of these things, which of course everybody needs to know the nuts and bolts of clinical medicine, right? You cannot be a provider without that. But here you can see that we are putting an emphasis on things that don't necessarily have to be their own classes. Certainly our work in healthcare equity, in provider well-being, and in ethics, which really just speaks to our mission. This may be a question that you've thought about, or sometimes we'll see this more in college students who are looking to transition and apply to PA school. A lot of people ask, are you going to have cadaver labs? Are you going to work with cadavers? And the short answer is that these things are still being hammered out. We will have virtual dissection tables, at least one in our simulation lab, which this is the architect's rendering of our simulation lab, which will have a lot of fun medical tools in it. But our goal is to have some cadaver time. It won't be on campus, but I think that's really important when you do procedures on human beings to have practiced that and really have a strong grip of the anatomy that is behind all of these procedures. In terms of clinical rotations, there are 7 required rotations for all PA programs in the United States. So you can see internal medicine, family, pediatrics, women's health, behavioral, surgery, and emergency medicine. At the Mounts program, we're also giving students 3 additional selective rotations because we think it's important that students see a variety of specialties to help enhance their learning. And then again, at the end of clinical year, we bring you back so that we can prepare you to take the boards, to become certified, capstone all of the important concepts that you've learned on clinical rotation, and just make sure that everybody feels really ready to care for patients as PAs. It's early for you guys to think about this stuff, but it's almost never too early because you have to be thinking about this as you enter into your undergraduate programs. What does it take to get into PA school? If anybody here has any knowledge of it, it's very, very difficult to get into PA school. And it gets harder every year. That's unfortunate. I always say I'm really glad I went 15 years ago. So for us to consider you, and this is pretty standard, is that you have to have a minimum GPA of 3.0. And then also your science GPA also has to be a minimum of 3.0. And there is I think in the next slide, we look at CASPA. So there's one central application system for all PA programs, which is very convenient. And they calculate that for you when you upload and put in all of the information on your transcripts. PA programs require that you come in with some aspect of healthcare, right? PA school, you saw 119 credits in 24 months. It comes at you fast. If you don't have anything for that information to land on, that can be really challenging. I think we have a slide coming up that talks about what counts, but things like being a scribe or working as a tech. We see a lot of medical assistants. We see EMTs. We see phlebotomists. Sometimes we see nurses. So a lot of different ways to get the hours so that you can apply to PA programs. We are definitely on the lower end of the spectrum. There are programs that require thousands of hours. The reason we are lower speaks to our mission for healthcare equity, right? We think it's important that you have the background, but it certainly doesn't need to be a career change. You have to have a contact time with the physician assistant. That's mainly so that you really know what a PA is and does and how it's different from other healthcare providers. 2 recommendation letters. One, we prefer to be from a PA, but it could be from another healthcare provider, a personal statement, and then we have a list of prerequisite courses that you have to get a B- or better in. Again, this is pretty standard for PA programs, right? It's H&P, micro. You have to have 6 credits of bios. That can be many different things. Organic chemistry with lab, chemistries, medical terminology, statistics, and psychology. So this is, I mean, you'll see minor variations from school to school, but this is pretty standard because when you get into PA school, it's like taking many, many upper level difficult science classes all at the same time. And so this gives you the foundational knowledge that we can then teach from. Our program has additional competitive factors that speak to our mission. So students who are first generation scholar, students with a higher science GPA, local candidates, which we talked about before. If you're a Mount alumni, we do give preference, military service or multilingual. And then in addition to the Mount St. Mary's alumni preference given in the screening, any Mount alum who meets the minimum criteria will automatically be given an interview. And it's probably hard to appreciate that now, but if this is where your future heads, you'll learn that just getting an interview is very, very difficult. So this is a real step up and a real opportunity for students. This is a picture of the lounge on the PA floor. Okay, this is just a slide that looks at what kind of healthcare experience would count versus what we know is not accepted, right? So things like being a sitter, shadowing, being a lifeguard, being a personal caregiver in the home, things like that definitely do not count. The things on the left do count. And then we also look on a case-by-case basis. So if you were looking to do something and you're not sure, this would be something you would email us about and we would take a look and work through that with you. Okay, this is just a quick slide. Again, this is years away, but just so that you know, there's a centralized application service for all PA programs in the nation. It opens every year about the end of April. So this year it just opened on the 25th. And then we would close our cycle on August 1st. So we will be in next year's CASPA cycle. So we'll be up and running ahead of when anyone here would be applying, but that is our application cycle and timeline. So opening in April, closing August 1st. Again, this just focuses on those Care for America scholarships that we discussed. We have a website, it's live now, called Care for America. You can read more details about it. But again, the scholarship gives a full ride through PA school in exchange for working in a high needs approved area for 2 years after graduation. So really incredible opportunity. I can't imagine if I had had an opportunity like this. I think it's great for both the students and for patients. Again, I think this is probably pretty far away, but you can expect that a lot of PA programs are interviewing in person. It's sort of a two-way acceptance, right? We're looking at you, you're looking at us. We want to make sure that it's a good fit. Our admissions process is holistic. So some PA programs just sort of look at all the numbers, right? Your GPA, your hours, those kinds of things, and just sort of take the top layer. We are very invested in students that align with our mission. And so we do look at a lot of things beyond metrics. We look at a lot of attributes and alignment of that. We get to meet students, we put you in scenarios. And so I think it's really an amazing opportunity for both the potential student and the program to get to know each other. This is just our accreditation status, which comes from the accreditor, ARC-PA, saying that we are in development and we are looking to achieve provisional accreditation in the June 2025 commission meeting next year. This, I don't think we need to go into because we're at the entry level of undergraduate, but there are some things, and certainly if you do choose the Mount, there are opportunities to face with us and with the PA program, and so that we can better help you prepare, not just to apply to our PA program, but really just to help you prepare to any PA program, because that's what the Mount wants. We want our students to be successful, and we put a lot of effort and energy into ensuring student success. So this is a QR code that takes you to the PA program's website. There's a lot of great FAQs on there, a lot of great information. I'm also available. I'm always happy to answer questions. I know that was probably a little bit of a deeper dive than we needed to do at this stage, but I hope that what's come across is that this is an amazing opportunity if you're thinking about what you can do with your science degree. And if you're thinking about healthcare, definitely consider if physician assistant is the right profession. And we are certainly here to help make that happen. And if you do come to the Mount, and we hope that you'll explore our PA program, which is opening soon. So thank you so much.
All right. Thank you, Mary. Really appreciate that. A lot of good content there. And like I said, everyone, this information is being recorded, so we will absolutely make sure that we email this out to you once we get the video file and do all that tech stuff behind the scenes. But for now, we didn't get any questions in the chat, so wanted to open it up. If anyone here does have any questions, feel free to raise your hand and we can call on you guys one by one. Feel free to ask questions about the PA program specifically. I encourage that, but if you have any other general questions for undergraduate admissions, Liz and I are here to answer those for you too. All right, well, looks like we don't have any questions, so won't keep everyone too late now. Ended right at 30 minutes, which is perfect timing, I think. So with that, I'll go ahead and stop the recording, and then everyone have a good rest of your day.
Thanks, everybody.